Again, good afternoon to everyone. Here is again your pharmacology RN and guru. I hope everyone is doing well and hoping most of you have reviewed the concepts and adverse reactions, because I have mentioned later on we will have our assessment task on the midterm quiz 1 pertaining to the adverse reaction. So the discussions that we have last Monday will be naman the part that will set for a quiz for this coming Friday. So I will have this period to set or to present to you our learning outcomes for the day, and to accommodate some of your questions and clarifications of the lessons discussed last time. If you still have many questions, I'm very much willing to answer, or for those who may not unmute themselves in asking the questions, our chat box are open for any questions that you may address. So, hoping also and expecting the others also to participate in our self-assessment exercises, the drug action during pregnancy. So let us start with the first question. The first to raise the hand will be the one whom I will call to respond. If no one will not respond, or no one will respond, rather, no one will respond to the question, then randomly I will pick students to respond and answer questions. So be attentive. The first question goes to: the nurse assists the pregnant client who is constipated. She will consider the drug action due to expected physiologic changes. Is it A, increased gastric pH? Is it letter B, decreased GI or gastrointestinal motility? Is it letter C, expanded maternal blood volume? Or letter D, it's increased glomerulofiltrate rate? Which of the following physiologic changes during pregnancy that may affect drug action, and considering that the nurse assists that the pregnant client is constipated? This has been unexpected physiologic changes due to what reason? Anyone? Is it increased gastric pH? Is it decreased gastrointestinal motility? Is it on the expanded maternal blood volume, or increased glomerulofiltrate rate? Anyone, even a guess, so that we could explore? Oh, thank you so much, Miss Shenny May Pelin.
Sir, ano po, hula lang po, decreased GI motility po.
Okay. So with your analysis pertaining to the uh, response or answer to the question, when you will analyze the question, we are considering constipation. And constipation is related to intestinal concerns or problems, right? And that's why pregnant mothers are being encouraged to what? This is the time, this is the one that I have emphasized last time, di ba? High fiber diet, increase fluid intake, engage into physical activities. So let us see if your answer is correct. Their answer is correct. Decrease gastrointestinal motility. Why? Because the decreased gastrointestinal motility during pregnancy may not what? May not initiate the movement of the what? Movement of the or the excretion of the our waste products outside the body to be excreted. The increased gastric pH may basically be unexpected physiologic changes and may cause a discomfort of what? If there is increased gastric pH, what discomfort that the pregnant mother may experience, and continuously may increase hydrochloric acid and may reflux to upper GI. What
Nausea
discomfort?
and vomiting po.
Correct. Oh, who responded? Who responded with that for you to be recognized?
Ay, Pelin po.
Okay, correct. Your answer is correct. Now, when we talk about letter C on the expanded maternal blood volume, di ba we have mentioned that when the mother becomes pregnant, then the physiologic change of expanding the maternal blood volume is to support also the fetal circulation. So that's why, di ba, most of the pregnant mothers during the early third trimester ay high risk po of iron deficiency anemia. So that's why supplementation is very much important. When it comes to the increased glomerulofiltrate rate, because of the fluid regulation, that will also support the fetal uh, regulation of fluid balance. The kidneys of the pregnant mother is actively supporting it. Aside from that, when when the pregnant mother increases the uterine size, the bladder could be compressed. And once the bladder will be compressed, there could be a what? There could be chances of a limited space to accommodate the urine in the bladder. So that's why every time that a pregnant mother usually are frequent in urination kasi nga yung space provided na sa bladder are being compressed by the increasing size of the uterine size, so it limits also the storage of the urine. Such will also give yung urge naman for voiding. That is the increased glomerulofiltrate rate. So you're correct. Next self-assessment exercise. Question. The nurse assists the pregnant client on her early third trimester. She's expected to be risk of maternal iron deficiency anemia due to alteration in clearance of drugs, decrease hematocrit, increase renal perfusion, or altered GI motility. So I think Ms. Tanghal is the first one who raised her hand. Your acknowledge?
Letter B po.
Your answer is letter B. Okay, let us analyze the question. The question is, first, highlight third trimester. Because, di ba, we have been oriented that the early third trimester, most of the pregnant mothers are high risk of anemia. Second, she's expected to be risk of maternal iron deficiency anemia. Anemia is related to blood. Now, you will now focus of the best choice from the choices, the best answer from the choices that is related to blood. Alteration in clearance of drugs may not be related to blood simply because the clearance itself is related to either the liver or the kidney. So hematocrit is seemingly related to blood. Renal perfusion, the term itself perfusion, circulating blood is also related to blood. And the altered GI motility is obviously not related to the circulating blood volume, moreover on the digestive or GI tract. So we do have only letter B and letter C. But having a close answer towards the cause of maternal iron deficiency anemia, from the term itself anemia, we will connect it with red blood cell. And under the red blood cell, we have hemoglobin and we have hematocrit. So which of this hemoglobin and hematocrit had been part of the choices? So the answer is letter B. So let us see if your answer is correct. So your answer is correct. Letter B, decrease hematocrit. So I hope you're learning in the presentation of this self-assessment exercise from the lessons that we have last Monday. Next question. This is all about the nurse will carry out prescribed medication of the pregnant client. FDA risk category A means letter A, no evidence of risk with well-controlled studies. Letter B, failed to demonstrate risk with no adequate studies. Letter C, with fetal adverse effect, and have no, that's to correct the statement, and have no adequate studies. And letter D, positive evidence of human fetal risk. Which of the following, A, B, C, or D, is FDA risk category? So I think Miss Manguera is the first one who raised her hand. Can I have your
Letter A
answer?
po, sir.
So your answer is letter A. So let us check if it is letter A. The answer is correct. Di ba remember, all drugs that is under category A are safe because it has adequate and well-controlled studies and no evidence of risk for the mother and the fetus. However, yung letter B, yung failed to demonstrate risk, ibig sabihin, it is still safe, but the opposite of letter A is it has no adequate studies. Letter B is referring to FDA risk category B. When we talk about that it has already identified fetal adverse effect. So, fetal adverse effect but no adequate studies, pero identified na from hindi man sufficient yung studies but it already identified yung drug may cause fetal adverse effect. That is category C. Now, if already kasi suspecting of fetal adverse effect, but if suspecting na yung letter D, it's already a positive evidence of risk. So that is category D. And the one that has been identified that confirms that the drug may lead to birth defects, that is category what? That is category what?
Category X po ba?
Correct. Thank you, Ms. Manguera. That's category X. Okay, next question. Still, we are on the drug action during pregnancy. The nurse administers a drug to a pregnant client. Which of the following drug is in FDA risk category X? We have folic acid, metformin, amoxicillin, simvastatin. Since the answer already revealed, okay? Since the answer already revealed, and considering folic acid is considered as category A. So it is safe for the both mother and fetus. So it has well and adequate studies. Metformin is categorized as category B. It is safe but no adequate studies. Okay, it may be category B and may need further monitoring. Amoxicillin is also category B. It failed to demonstrate risk but no adequate studies. And the answer is simvastatin. Simvastatin, the statins are anti-hyperlipidemic drugs. So that's why if you are aware that someone is taking this drug and confirm that she is pregnant, so have the initiation to withhold the drug because it may be on the category X identified with high risk of birth defects. Next question. So I will just slow it down so that I may not reveal the answer. The pregnant client consulted an obstetrician due to intake of cocaine. So these are the most substance abuse. Substance abuse. The nurse is aware that it may lead to fetal effects of letter A, fetal alcohol syndrome. Letter B, toxicity to embryo. Letter C, decreased head circumference. And letter D, we have neonatal meconium aspiration syndrome. Miss Tambot, first raise her hand.
Si po.
The answer is decreased head circumference. So let us see if that is your answer. That is the correct answer. Correct. Thank you, Miss Tambot. If we are considering fetal alcohol syndrome, obviously the term itself is in the answer is in the choice because 1 ounce, di ba? 1 ounce in a week that a mother may take could be high risk for spontaneous abortion, but for the fetus or fetal or neonatal effect is fetal alcohol syndrome. When we are talking about toxicity to embryo, we are talking about what? We're talking about caffeine. And caffeine, once it leaded to the intake of 6 to 8 cups, that is already toxicity to embryo and category C. If we say neonatal meconium aspiration syndrome, this is more on the substance abuse heroin. Okay. So let us now proceed. Next question. Next question is the pregnant client who is known smoker is being educated by the nurse since she is high risk of A, spontaneous abortion. Letter B, the degenerative placental lesions. Letter C, we have preterm labor. And letter D, we have decreased intervillous blood flow. I think Miss Prestosa Katrina May is the first one who raised her hand. What is your answer?
Letter B po.
Okay, so let us check if the answer is correct. The answer is degenerative placental lesions. Class, remember, for a pregnant mother who is on active smoking, the nicotine itself is the harmful substance that may cause the possibility of risk to the mother and also with the fetus and the neonate. However, spontaneous abortion are identified with alcohol, identified with cocaine, with heroin, and preterm labor are more on identified in the methadone, and decreased intervillous blood flow are identified to other substance abuse. The degenerative placental lesions are more on the tobacco or the cigarette smoke. If we say degenerative placental lesions, these are permanent, okay, permanent placental lesions or tissue damage. Pag sinabi nating degenerative, the tissues cannot be repaired anymore. So it may compromise the maternal to fetal circulation. So next, so that's why if you have known individuals who are still smoking or pregnant mothers who have been exposed to primary smoker, it may have the same impact, or should I say a higher impact for those who are exposed to the secondhand smoke. So problem yan. Next question. Next question, hoping I may hear from the others. Out of the 40, how many are we? Out of the 40 students that we have, I'm hearing only 5 out of the 40. So hoping the others will also respond. The nurse is aware of the recommended daily allowance of iron during pregnancy. Is it 18 milligrams per day? Is it 27 milligrams per day? Is it 0.4 milligrams per day? Or is it 0.8 milligrams? So I think, so probably I may give chance to the others who have not been called. So yung second, thank you Miss Manguera. I will call probably the second po. No? So wag magtatampo. So we may have Miss Mendoza and
Yes, sir. Ano po? 27 milligram per day po.
okay,
Letter
kasi
B.
'di ba we have thank you. Let's check if your answer is correct. So your answer is definitely correct. 'Di ba we expect that the higher recommended daily allowance to pregnant women compared to normal individuals. The 18 milligrams per day are those for recommended daily allowance for 18 to 30 years old, which is non-pregnant. The 0.4 milligrams naman is the minimum recommended daily allowance for pregnant 2 to 3 months per folic acid. The 0.8 milligrams naman is yung maximum recommended daily allowance naman for 2 to 3 months pregnant for folic acid. So I hope you have been refreshed with those the self-assessment exercise that we have, and there are more self-assessment exercise coming as we continue with our discussion. So do you have any questions from the lesson last Monday? Students, our 40 students, do you have questions? None so far. Thank you. So now we'll now proceed to the alternative therapies. Here in the Philippines, we have it's part of our culture, it's part of our community and environmental culture that even by generations we are exposed to traditional herbal medicines, but there are some situations that we must set limitations that it may cause a possible effect to pregnant mothers. Most of the drugs that I will be presenting to you now are complementary or alternative therapies, which is somehow herbal preparation that should be avoided. The term is should be avoided because somehow this could be, if you will check in the drug handbooks or even in the search engines by Google, these are yung mga herbal preparations na kaya nga no approved therapeutic claims may cause harm to certain conditions na hindi naman siya directly considered as the treatment. So let's have this. As a disclaimer po, I'm not connected with these brands. Okay. However, I just sought this content of herbal preparation that should be avoided based from the updated 10th edition of the pharmacology. The photos that had been used or that are used here are for purposes of the education. So now let us start with fever, pew, and sage. Very international yung herbal. Pero pag nakita niyo naman yung mismong plant, you're familiar with it here in the Philippines. So yung fever, pew herb supplements, these are vegetarian capsules. Actually, these are dietary supplements. Pag dietary supplements talaga, it should be avoided during pregnancy kasi you need yun nga di ba? For iron nga, we need 27 milligrams per day. Then you will have the dietary supplement pa. Baka it may deprive the maternal and the fetal circulation. Do you know that this herbal preparation of fever, pew, and sage are emmenagogues? If we say emmenagogues, these are drugs that may stimulate bleeding. So, this may stimulate blood flow in the uterus. Kaya pag sinabi nating emmenagogues, this may cause or may risk to bleeding. So, we could say that this could be possibly abortive patient. If you say abortive patient if the mother is pregnant and bearing a fetus inside, the bleeding itself may trigger the expulsion of the fetus, and possibly may cause the miscarriage or the spontaneous abortion. So this must be avoided because this may induce the bleeding. Next, we have the what we call Kava. So the Kava extract. The Kava or the Kava extract is an alternative or herbal preparations which is used for stress relief. Mga stress relieving preparations daw po ito. So ang problem nito, this should be avoided during pregnancy because it decreases platelet. Okay ha? So students, if there are supplements at home, be cautious, be cautious and be conscious. Lalo na kung merong mga pregnant po kayo na family members and relatives who are living with you, and these are mga common herbal preparations na pinapadala even from abroad or somehow had been offered for free by some of the agents. So we must be aware that it should be avoided because it will decrease platelet. Concern, di ba, ang physiologic changes during the pregnancy that we have known is it will expand the circulating blood volume. Kaya nga po, that's why the pregnant mother is high risk for the anemia. So if the pregnant mother is high risk for anemia, then somehow it will decrease the platelet, then the chances po then that it may induce bleeding. So pwedeng mag-lead yan into spontaneous abortion. Kung di man siya mag-lead into spontaneous abortion, the bleeding itself may lead to hypovolemia. The term itself is hypo, decreased volume of blood, ischemia. And too much profuse or yung too much na profuse is the same. Profuse bleeding itself may cause the what we call hypovolemic shock because it will definitely affect the circulating blood volume. So remember Kava or Kava plant. And here comes the tantrums of my nephew. The ritual itself. Let us continue. Now, you're familiar with some of the component. Yan. The background sound is not connected to the complementary and alternative therapies. Let us now proceed. Number 3. I will just list the noisy. Okay. Now he's being isolated. Now, let us continue with the complementarian alternative therapies that should be avoided during pregnancy. Ito, I know these are common with you. Dongquai, garlic, ginkgo biloba. Oh, yung ginkgo biloba, familiar kayo because it has been advertised, ha? But it is a supplement. Garlic are always available in your kitchen. So regularly available to in your kitchen. Ang problem nito po, it should be avoided simply because of the chances that may increase bleeding when used with anticoagulant. I have, for example, the pregnant mother was prescribed with an anticoagulant, either yung mga anticoagulants natin are those yung mga ending in rins, di ba? Yung mga warfarin, aspirin, heparin. Yan, if the pregnant mother is receiving this, as much as possible, don't ever or discontinue if she is taking any of this dongquai, garlic, and ginkgo biloba. Because aside from the fact that these are considered also, yung dongquai is considered as dietary supplement. And this may increase bleeding. And it may cause increased bleeding, as what I've told you, this may cause a possibility of abortion. Even di ba during the pregnancy, spotting itself, the spots lang ha, the spots in the pads or in the underwear of the pregnant mother is already alarming because that's an indication that chances of high risk condition of the pregnant mother. However, and moreover, if the person who's experiencing that may also take this, then this may induce also the risk for bleeding. So remember these herbal preparations. Next, ginseng. I know you are familiar with ginseng. Mga Korean fanatics, ginsengs are usually part of their culture. So ang ginseng po we are very known that it will boost immune system. Okay. However, please hold the intake of this muna during pregnancy, and it should be avoided simply because the fact that this may lead to the possibility of decreased action of anticoagulants. So for example, if the pregnant mother is having a problem with bleeding and somehow advised to take, or she is presently taking and prescribed with anticoagulant, and at the same time the person to boost her system, she's taking ginseng, it will not support the purpose of the anticoagulant. Further, kung kinounteract ang anticoagulant, what's next? It will cause bleeding. So what from the number 1, number 2, number 3, and number 4 herbal preparations, if you will notice, what are common with all of this is it will cause the bleeding itself. So next po, ito, St. John's wort. Ayan. Ang St. John's wort po, meron ito sa Pilipinas, but in the preparation of drug, these are herbal preparations that boost positive mood. So ano rin to, parang stress reliever din, katulad nung drug that the herbal preparations that we have mentioned a while ago. Ang problem naman sa St. John's wort, if you may have this, the pregnant mothers should avoid this because of the mutagenic effect. What do you mean by mutagenic effect? From the term itself, mutation. This may affect the development of the embryo and the fetus. So it may delay the development of the embryo. Thus, chances that it may cause a risk for birth defects. So be cautious and be conscious about this St. John's wort as herbal preparations and alternative therapies po for mood. So that's why as much as possible for pregnant mothers, they are encouraged to have mga non-pharmacological therapies rather than taking herbal preparations. So nurses, put this in mind that you must take into cautious any herbal medicines, lalo na pag mga tiha, kasi di ba usually ang mga tea coming from the leaves and root crops, lalo na pag mga root crops na extracted, yan yung mga ginseng, medyo somehow pwedeng mag-risk sa pregnant mother. So another is we have the what we call Penny Royal. This is an organic drug, pero klasa when it is taken orally or applied topically, yung either oral and the topical preparations, this could be abortifacient. Abortifacient. Pag sinabi natin abortifacient, this will cause and risk for abortion. So please be aware of these alternative herbal preparations to pregnant mothers. Next po. Now we have those alternative therapies. We will now proceed to the drugs for minor discomforts of pregnancies. The minor discomforts of pregnancy that are usually introduced to you, usually in the first trimester, are nausea, vomiting for a while, pain. I don't still have questions. For a while, we have pain, nausea and vomiting, possible heartburn. Yan, kasi 'di ba the nausea and vomiting, what is our rationale? Why there's nausea and vomiting? Because there is during pregnancy, the physiologic change is increased gastric pH. Next is pertaining to the vomiting, because it will induce the vomiting, chances that the pregnant client could be high risk of dehydration or electrolyte imbalance. So another is why the client is experiencing pain. So the pain itself is due to increasing in size, di ba? Pag nag-i-increase ang size of the uterine mass of the uterine side of the uterus, it stretches the uterine muscle fibers. Once it will stretch the uterine muscle fibers as it increases, the chances also that the nerve endings are also affected when it comes to the response of motor pain. So another that causes the pain on the early pregnancy concerns is that of chances that, di ba, pregnant mothers, because of the increasing size of the uterus, the increasing size of the uterus itself adds to the weight of the client. As it adds to the weight of the client, it may cause somehow the physical stature that may cross the pain up to the back, which someone mentioned this in the last meeting that we have. So let us start. So we will now consider those drugs that will be drug of choice for those who are experiencing nausea and vomiting. However, for nausea and vomiting, the non-pharmacological management that we could advise is the patient may have, once there will be frequent vomiting, the patient may have small frequent feedings, or for the meantime may be on NPR, nothing per orem for the meantime. Second, if it could already stabilizes the gastric condition or the pH, the patient may take dry crackers. Then small frequent feedings, avoid food that are spicy, tapos the food that are not good for smell, kasi this may induce nausea and thus later will lead to the vomiting. So these are situations. Now, usually the one that is usually part the receptor or the impulse that has been part of the inducing nausea and vomiting is the histamine 1 receptor. So remember the histamine 1 receptor, the one that causes constriction in the bronchi when there's asthma attack, the one that causes redness when there are allergic reaction. And when it comes to the histamine 1, this is the one that usually affects and possibly cause the increased digestive activity, just induced pa yung what we call in reflux of the hydrochloric acid. So let us now proceed to the drug of choice. You may now observe that why I consider the drug of choice, kasi number one, pyridoxine or vitamin B6 is category A. So we are aware that the category A is safe. and has sufficient studies as well. So the drug of choice for nausea and vomiting is pyridoxine. These usually integrated as board exam questions. Kasi the pyridoxine may serve as a coenzyme to balance yung tinatawag nating metabolic response ng pregnant mother, specifically the physiologic one, to avoid the further increase of the hydrochloric acid. So before I continue, again the chat box is open for questions if ever there are, or you can unmute if there are questions. Next po, we have the second choice probably is the what we call doxylamine succinate. Doxylamine succinate pyridoxine. So still in the generic name, we are having doxylamine succinate and at the same time we have the pyridoxine. Kasi remember class, the antihistamine or the histamine 1 receptor antagonist are those drugs ending in amine. Diphenhydramine, chlorphenamine, doxylamine. So H1 ano yan? H1 blocker yan. And mixed with pyridoxine. So it has the antihistamine effect tapos plus the vitamin B6. However, it has anticholinergic effect. Okay, pag sinabi nating anticholinergic effect, what is being counteract? Is it parasympathetic or sympathetic? What is being counteract if we say anticholinergic? Our 40 students, I need to hear responses. If we say anticholinergic, what is being counteract? Is it parasympathetic or sympathetic?
Parasympathetic po.
Correct. Because another name for who responded with that for acknowledgement?
Pelin
No?
po.
Okay, thank you so much. Because cholinergic is associated with the parasympathetic and we have adrenergic that is associated for sympathetic. So if it is anticholinergic, okay, anticholinergic, it counteracts the parasympathetic. And remember po, the response of parasympathetic and the digestive activity is increased. Kaya if we counteract the cholinergic effect, it will decrease digestive activity. So why this doxylamine succinate and pyridoxine is not the drug of choice? Kasi it may not for use, it is not indicated for use for nursing mothers. Those who are remember this those who are having breastfeeding, hindi po sila advisable since it has antihistamine. Di ba remember, pag most of the antihistamines meron yang side effect of slight drowsiness. And thus this may also be excreted. And sinabi natin yan during the time that we discussed about pharmacokinetics of elimination that one of the minor excretion routes ay the what you call this, the breast milk. So that comes from the breastfeeding. So yun po. So the pyridoxine or vitamin B6 is the drug of choice. Let us now proceed to the next. The next po is we have the promethazine. Promethazines po ay it competes for H1 receptor. So still this is considered as antihistamine or H1 receptors. So ang promethazines are phenothiazines. However, it's category C. Will it take risk to the fetus? Will it take risk to the fetus? Students? Yes. Okay, kasi if we are considering category C, this concerns specifically on the perspective that there is a identified adverse effect to the fetus but insufficient studies or no studies at all. So, yun nga lang, remember po na ang mga promethazines or phenothiazines, kung bakit siya category Z, it's because this may cause also drowsiness as side effect. So somehow, pag ang side effect na po ay drowsiness, Remember po, it's direct to the central nervous system, which is the brain. Ngayon, why it's category C? Because it's contraindicated with CNS depression. So ano yung may mga CNS depression? Yung mga CNS depression, ito yung may mga possibility na may altered brain functions, and somehow this may cause the concern po na mag-induce pa ng CNS or depression and may lead to suppression. Pag nag-lead na yan sa suppression, this may have a direct effect on the brain. So from drowsiness, it may alter na po yung level of consciousness. Kaya careful po. So category C. That's why if this is prescribed by the doctor, what will be the nurse? Hindi mo naman pwedeng, you may not tell to the doctor, sir, doc, why you prescribe it? It's category C. It could still be administered, but what will be the role of the nurse is to monitor the fetal well-being, kung mag-fetal distress siya or maka-experience din ng CNS depression. So ibig sabihin, pag nag-CNS depression siya, pag nag-fetal distress naman ng baby, tataas ang fetal heart tone or ang fetal heart rate. So that's fetal distress. Tapos if there eventually, pag nag-fetal distress, biglang taas tapos biglang bumababa, that's a critical condition. That's really a critical condition. Kaya remember class, when there's already fetal heart tone that is almost increasing, then that is an indication that the baby is not doing well. And anytime once it will cause a complication, it may have a sudden drop of the fetal heart rate. And ano naman yung pwedeng mangyari? Pwedeng mag-lead ito into the fetal demise, or the fetus will lead to its death inside the uterus. So next, other the promethazine is we have the scopolamines. So scopolamine, okay, scopolamine. So kadinig siya ni nung first drug. So doxylamine kanina, 'di ba? Doxylamine. Ito naman we have scopolamine. So amine. So ibig sabihin it's antihistamine. Ang concern naman dito, it antagonizes, from the term is antagonize, it contradicts the result of the histamine, pero dito kasi may serotonin. Ngayon, anticholinergic siya, it contradicts the action of the parasympathetic, pero category C din siya. Okay? Always remember kung bakit siya category C, kasi it will use in caution to patients with liver and kidney impairment. So that's why for a pregnant mother, before giving the scopolamine, what will be your role? Okay, your obstetrician will tell you, okay, please administer scopolamine to the patient. What will be your primary role is to check any basis of functions, diagnostic results related to the liver and the kidney function. So for the kidney, we may have the creatinine. For the liver, we could have the liver function test. If diagnostic exams results are not available, then what could be the basis of the observation? It's pertaining to the urine output, or however, if it is hepatic, if the patient may have jaundice or yellowish discoloration of the skin. So that's why pag may mga contraindicated na yan, ayan, yung mga category na yan, it's more a higher level. So let us again review. So yung first one that we discussed is pyridoxine B6 is the drug of choice. Doxylamine, succinate, and pyridoxine. This is an anticholinergic, pero you must remember this must not be given. This must not be in use for nursing mothers. For promethazine, this must not be in use with the CNS depression. Scopolamine, this must not be in use for may liver and kidney impairment. So these are the things that you need to take into consideration, because the nurse will be guided on how you will complete the drug history in relation to the pregnancy, and at the same time with certain comorbidities. So another drug that can be associated with nausea and vomiting. I've been again, as I have mentioned, I've been in the delivery room, the labor room, operating room. Most common drug other than kung walang pyridoxine or vitamin B complex. So usually there's a vitamin B complex. Yung vitamin B complex usually it will be mixed with the IV fluids eh. Pero if there are no vitamin B complex that are available, the usual drug that are given is the what we call metoclopramide. The metoclopramide, the brand name is Placental. This is prokinetic agents. Pag sinabi natin, if we say prokinetic agents, it will induce kinetic movement. So, di ba remember na yung chances kasi that when the person vomits, that's an indication of clearance ng gastric content. So once 'di ba pag na-clear na yung gastric content, the person feels relief, feels the relief. So eventually it will induce the motility, but it will accelerate gastric emptying na hindi naman mag-stimulate ng hydrochloric acid. So ibig sabihin, mag-empty yung stomach mo but it may not cause hyperacidity. So ito po ay prokinetic metochloramides category B. We have mentioned that it could be this is failure to demonstrate risk. Okay, may fail to demonstrate risk sa fetus, pero compared to A, it has no evidence or well-controlled studies. So these are the drugs for nausea and vomiting. Next po, how about pain? Okay, very common. Very common. The safest pain reliever po that could be administered to pregnant women is acetaminophen. Acetaminophen is non-opioid analgesic. So remember di ba pag ang opioid analgesic, narcotic analgesic, again, it may have the direct action to the central nervous system to control the pain response. Ngayon, usually in the 26th week of pregnancy, the pregnant mother experiences headache, which is usually unexpected discomfort because of the hormonal changes, induced body changes, also pwedeng sinus congestion or eye strain during the 26th week of pregnancy. So the drug that can be used in all trimesters, ibig sabihin the acetaminophen can be used in the first, second, and the third trimester. The maximum dose is 300 milligrams, pero it should not exceed 12 tablets for 24 hours. Because, again, remember this any pain reliever, once it exceeded to its dose, will lead to kidney and liver toxicity. So somehow we need to be careful that there is only a limit of 12 tablets of this drug so that to manage pain. Kaya nga nurses, you need to take into consideration po the chances that we must promote non-pharmacological management rather than pharmacological. Kasi remember, di ba, yung natural way of compensation in the body through a non-pharmacological management is you are also promoting that the body will respond spontaneously with these discomforts. So, yun either yung minimension natin, it's the sympathetic and the parasympathetic response. But if ever the drug itself is the one that will control, that will cause the relief of pain, that is already, it mimics na the natural action. That's why nagiging sympathomimetic or parasympathomimetic yung situation. Kaya class, even in your exam, I'm checking on your exams, some of you have confusions na if it is the natural response of the body, it's sympathetic or parasympathetic. But if the drug itself is the one that acts on behalf of the sympathetic and parasympathetic, that is already sympathomimetic or parasympathomimetic. So remember, the drug of choice for the pregnant women that are safe for all trimesters is acetaminophen. Heartburn. Ayan. You know that the heartburn is almost 80% of pregnant patients are experiencing heartburn or what we call pyrosis. Now, the problem with heartburn is hormonal because the increase in the progesterone causes decreased gastric motility. Ayanan. Ito na yung sinasabi natin na nagde-decrease yung gastric motility, hindi siya nagpo-produce ng ng sufficient hydrochloric acid to support digestive activity, tapos yung gastrointestinal tract pwede na mag-lead into constipation. So pag hindi nag-cause yan ng movement ng stool into our intestines, what happens is our stomach will keep on producing hydrochloric acid, at pag elevate yan or nag-reflux yan in the intestinal tract, pupunta yan sa esophagus. Pag may acid po kasi, mag-expand ang esophagus. Once the esophagus will expand, at lalo na, di ba, since acid siya, it may cause irritation to esophageal tissues. Pag nag-cause ng swelling yung esophagus mo, there will be thickening of tissues. Alam niyo naman na yung part nito ay pwedeng mag-cause ng friction with the heart. Kaya siya tinawag na heartburn, kasi yung outermost covering of the heart may have a contact with the esophageal tissues, at doon nagko-cause ng friction, and that causes heartburn. So usually, di pa, if you are experiencing stress, anxieties, yan, nagkakaroon na ng heartburn. So, but for pregnant women, usually it is caused by the increased progesterone. Then it is usually 80% of pregnant patients. So most of the heartburns are being managed by antacids. So ano yung mga antacids that we consider? Aluminum, magnesium, yan yung mga common antacids that we have. So the first drug that can be used for the heartburn or pyrosis is aluminum hydroxide. So it's an antacid. The category is not assigned. However, ang aluminum hydroxide, sometimes there is a brand name of Ampogel, is over-the-counter preparation. It could be purchased into drugstore, and the heartburn is secondary to the reflux, yung acid reflux. So usually the side effect is constipation. So again, nurses, you need to take into consideration, if the pregnant mother is experiencing heartburn, then at the same time constipated na siya, don't take risk to give aluminum hydroxide, because it may trigger further problem with constipation as side effect. So another is do not mix aluminum hydroxide with phenothiazines. So a while ago, we have discussed that phenothiazine is a drug that are used for nausea and vomiting. Ngayon, if phenothiazines are prescribed to the pregnant client and aluminum hydroxide at the same time, much better that it should be given on a different time. It should be given on a different time. Same as with the isoniazid. Actually, isoniazid is an anti-tuberculosis drug. So, antibiotic din ito for tuberculosis, which must not be given at the same time with aluminum hydroxide, because it will decrease its effect. So, ayan po, aluminum hydroxide. Actually, an alternative, kung may constipation po siya, one of the alternative that you could give is magnesium hydroxide. Okay. Yung magnesium hydroxide naman, ang side effect naman ng magnesium hydroxide actually is diarrhea. So that's the opposite of aluminum hydroxide. If you will encounter milk of magnesia, the milk of magnesia is considered as magnesium hydroxide. So meron naman drug na magkasama na si magnesium hydroxide at kasi aluminum hydroxide. May simeticon pa siya. And this is what we call maalox. Yung maalox po are anti-flatulent drug. Pag sinabi natin anti-flatulent, in colloquial, ito yung mga magtitreat or hindi magtitreat, magre-resolve ng problem with abdominal distension, or in Tagalog, kabag. So, pag ang problem ng yung heartburn itself because of too much air, 'di ba, sa abdomen, tapos at the same time it causes the reflux of the what you call this, the acid, this really cause discomfort, minor discomforts to the pregnant mother. So the drug of choice could be magnesium hydroxide. The drug that could be considered is magnesium hydroxide, aluminum hydroxide, and simeticon. So kung nadidinig yung Gaviscon, so it just package into one. However, ito po yung concern natin. It's category C. So category C, careful tayo, because it has no evidence of studies, pero it has been recorded and documented na may adverse effects sa fetus. So uh, ang maalox or magnesium hydroxide or aluminum hydroxide should not be administered with magnesium-based antacids. Pagka ang eto class, remember ha, pag ang antacid ay may magnesium, never give it with renal disease, with kidney problems. Ha? Be cautious with that because it may trigger yung kidney problem. So yun po ang certainly that you must know as a part of your nursing responsibilities. Okay, so I think that this slide has been covered already, the pain. So now, before maybe we proceed with this, because we are already gearing towards preterm labor, probably I may set first a break so that you meet hydration, physiologic need. So for this, siguro maybe this time a longer time kasi I only set 10 minutes. So it's already 6:20. So probably we'll have 15 minutes if that could be okay with you. The 15 minutes for you to hydrate and support yourselves with food to meet your physiologic needs. So for 15 minutes, we will resume at 6:35. Okay, so be back at 6:35. Thank you so much. If you have questions, don't be hesitant to post it in our chat box even on break. And I will be very much willing to respond. Thank you so much. Okay, so we'll resume. So I have exceeded almost 5 minutes. So I hope you have enjoyed your hydration. And at 6:45, the midterm quiz one will just be posted, but still not open. So for you to just check, but it will open at exactly 7 o'clock. So we still have 20 minutes to discuss our continuation with the drugs that decrease uterine muscle contraction. We are already talking about preterm labor. So moreover, you have encountered this in some of documentaries, in some of the movies, and even teleseries, that situations like that they do preterm labor, and most of the advice of the obstetricians are complete bed rest. Why? To the extent that anything that triggers uterine muscle contraction, opening of the cervix, is a risk for chances of premature delivery. And with the premature delivery, who will be at risk? Both the mother and the child or the newborn. So class, remember, we have already mentioned po that there are cervical changes and already identified uterine contraction with a certain period of 20 to 37 weeks. Yung 20 to 21 weeks is the yung period of viability, na pag nag-reach na sa above the 21, it's already viable, but it's already risky if it is 20 years old. Chances pa yan expulsion pa ng fetus yan eh. So ang ano diyan, between the 20 to 37 weeks, these are the periods that are very critical if it cause already spotting, if it cause even minor contractions, or yung talagang abdominal tenderness lang, which is an indication of muscle contraction. So it's between 20 to 27 to 37 weeks. So since the problem of this concern of preterm labor is uterine contraction, then there must be a drug to counteract the problem with the uterine contractions, and that is what we call tocolytic therapy. From the lytic, so we have used lytic, di ba? Lytic is to inhibit, to prevent. So this somehow just the same as anxiolytic, mucolytic. So tocolytics, if you will encounter tocolytics, these are the drugs which are identified to patients, which are prescribed to patients with true preterm labor. Remember, you have I know that it has been introduced to you what are the false and the true labor. So when it comes to true preterm labor, which is basically evaluated by the specialist or expert. So this is a drug therapy to decrease the muscle contractions. And with that, we have the goals of tocolytic therapy. So what could be the purpose of having tocolytic therapy? So obviously this is to interrupt and inhibit uterine contraction. Remember class, the more that it will have uterine contraction, the chances that this contraction will create a pressure inside the uterus, intrauterine. And what is inside the uterus? So obviously we have the fetus. So once it will cause the pressure, kung 20 weeks yan, the chances that it will cause the possible miscarriage. And if it is above 21 to 37 weeks, that could be the possibility when it comes to the premature delivery. So yun, pwedeng maging premature baby once it will have the premature delivery. So that's why we need to interrupt or inhibit. So class, that's why anything that any factors that may cause preterm labor or preterm uterine contractions, yan yung mga usually yan anxieties, something that may trigger yung situation. So ano rin tayo, focus din tayo on the causes. Next is delayed delivery. So that yung delayed delivery po is to make the well-being of the fetus continue in the intrauterine life until reaches the appropriate weeks of gestation. So if chances kasi in the delay of the delivery, pag preterm labor, at chances talaga na there's already a continuous contraction at hindi na talaga may iwasan at nag-open na yung cervix. Once it opens the cervix, there could be a possibility na there could be a chances na mag-cause na to ng ng preterm delivery. So usually steroids are being given to the mother so that to support naman yung surfactant sa lungs ng fetus. Kasi once the premature baby goes out in the extrauterine life, yung steroids itself, beta-metasone usually, mga zone, usually beta-metasone supports the surfactants to help the heart expand. So another is if chances that the patient will have the preterm labor or there's already bleeding or spotting, the tocolytics will definitely have the safe transport while going to the appropriate facility. So interrupt or inhibit, delay delivery, and safe transport. These are the goals of tocolytic therapy. So let us start with the drugs that decreases uterine muscle contractions. The most common drugs that are being used as tocolytics always when you are in the delivery room, lalo na kung ikaw ay nasa labor, usually the drug that are being given is what we call terbutaline. Actually, ang terbutaline po, if you can see in the projection of the classification, beta-1 adrenergic agents. Pag beta-1 adrenergic, this is the difference ha. Beta-2 is identified with the heart, beta-1 is identified with the respiratory system. Pag beta-2 receptor adrenergic, it will increase contraction. Pag beta-1 adrenergic, it will open the bronchial muscle for airway passages. So this may also facilitate and may help the mother also to have a good respiratory function. But other than that, the purpose of it is it relaxes the bronchial smooth muscle. At the same time, it relaxes the uterine smooth muscle. So since the purpose ng terbutaline to open up the bronchi, which is usually given pag may mga asthma, this is also intended not for the bronchial smooth muscle, but its effect itself may also have an extension effect sa uterine muscle so that to prevent the what we call premature or preterm labor. So it's category C. So again, category C, while uh, the patient is receiving terbutaline, usually it is given either intravenous or through the drip or piggyback. It is mixed with the intravenous fluid. So you must always monitor. Anyway naman, if the client is already in the preterm labor, you always take into consideration also the fetal well-being by checking the fetal heart tone through a Doppler or fetoscope. So another drug that can be given on the uterine muscle contraction is magnesium sulfate. However, this is the concern ha. Terbutaline is most commonly used over magnesium sulfate. Kasi ang problem with the magnesium sulfate, it's category D. So di ba ang category D, positive na yung identified risk sa fetus. Kaya medyo maraming contraindications dito. And usually, if you have studied about the checking of reflexes, when you are about to give magnesium sulfate, it must take into consideration the checking of DTR or what we call deep tendon reflexes. Class, always bear this in mind. This will somehow appear in the board exam. Now, if there is negative deep tendon reflex, don't administer magnesium sulfate. Why? Because if you will administer magnesium sulfate, there could be a possibility that the mother will be paralyzed. That is one that may be leading to its health condition or major health condition problems nito. So, kasi ang isa rin sa magnesium sulfate, pag it will be administered to the client, chances din po nito ay pwede po siyang maging risk for toxicity. So kung nagbibigay po kayo ng magnesium sulfate to decrease uterine muscle contractility during the preterm labor, always be on the side antidote, which is calcium gluconate. So this is somehow pagka nag-manifest na yung mga signs of toxicity of magnesium sulfate, always consider an emergency drug as an antidote, calcium gluconate. These are least commonly used yung magnesium sulfate kasi nga these are contraindicated with myasthenia gravis. Actually, ang myasthenia gravis is a nerve problem which basically, pag may myasthenia gravis, ang mga nangyayari dyan ay nagkakaroon ng limitations sa mobility. At usually yung acetylcholine is the one that are being considered na affected sa nerve. At remember, pag once nerve are already affected, it may have a major impact in the functioning of the body. So pag nagkaroon yan ng impact, so maglilid yan sa toxicity at chances po ay pwede pang ikamatay. So careful tayo, kaya that's why it's categorized as category D. So that's why the uterine relaxants or tocolytics, aside from the mentioned, are, ito yung sinabi natin kanina, we have magnesium sulfate and we have, this is actually terbutaline. So it says here 30 weeks kasi sabi nga natin 20 to 37 weeks is already a preterm labor if it have the identified true preterm labor. So other than that, aside from magnesium sulfate and terbutaline, nifedipine could be used also as uterine relaxants, and indomethacin as non-steroidal anti-inflammatory drug can be used also as alternative, but depending on the obstetrician's prescription. Pero aside from that, kailangan maging flexible tayo that if magnesium sulfate, if terbutaline is not available, magnesium sulfate, it could be either nifedipine or indomethacin. So on the other hand, ito na yung sinasabi nating preterm labor. Pag nag-preterm labor na, sabi natin we have the preterm labor na 20 to 37 weeks Pero very crucial na yung 24 to 34 weeks kasi this is now the risk naman of period. Yung kanina preterm labor, di ba? 20 to 37, pero yung period of 24 to 34 weeks, risk na yan for preterm delivery. Once the patient will be in labor in this identified weeks. So pag nurses remember this if within these weeks of 24 to 34 weeks at nag-open, nagiging regular na yung uterine contraction, tapos nagpo-cause na ng effacement, yung thinning of the cervix because it already open, there is cervical opening, the doctor will prescribe na a corticosteroid. So the choice is usually for prevention of respiratory distress of the fetus in the extrauterine life. So this is to prevent respiratory distress syndrome. So betamethasone, although it's category C, category C kasi nga alam natin that the steroids may greatly affect yung kidney function, kaya careful tayo. But on the other hand, its purpose naman is to prevent respiratory distress, to stimulate surfactant, tapos this is usually injected to the mother prior to delivery. Hindi na yung magdi-deliver kasi it may not anymore circulate to the baby, but it must be prior to delivery, and this is to promote the fetal lung expansion through that surfactant. So betamethasone. Sir, how about if we don't have betamethasone? So the other choice is dexamethasone. Ang concern lang natin, if we will have dexamethasone, the effect of corticosteroid is the same, but ang problem with dexamethasone, mas shorter yung half-life. So ibig sabihin, if the half-life is shorter, the shorter its effect. So betamethasone must be the one to be administered over dexamethasone. Yun nga lang, if there are no betamethasone, the dexamethasone is the one that can be administered. So remember, the steroids for pregnant mothers is considered as category C. Kasi the surfactants that we are talking about is to stimulate the phospholipids myelin and lecithin, which is very important for the lung functioning. So let's have self-assessment exercises before we proceed with our midterm quiz 1. A patient in her first trimester of pregnancy caused the nurse to ask for suggestions on decreasing nausea in the morning when she wakes. Which of the non-pharmacological measures are used to decrease nausea and vomiting except? We are talking about except. Number 1, eating crackers, dry toast, or other carbohydrates before rising. Letter B, eating small frequent meals. Letter C, we have eating high protein at bedtime snack. Or letter D, eating high fat or seasoned foods. So which of the following are used to decrease nausea and vomiting except? So you will look for the wrong statement here. Any response? Yes, Miss Sipin.
Sir, letter D po.
Letter D. Okay, let's see if that is correct. The answer is eating high fat or seasoned food. Why? Kasi remember, fats are insoluble. Seasoned foods can irritate the gastric lining. So pwedeng mag-stimulate into further production of hydrochloric acid. Next question. A patient is complaining of continued constipation. So after non-pharmacologic constipation treatment was attempted without success, which drug would be a first line of treatment for constipation during pregnancy? So do we have docusate sodium? Do we have magnesium citrate? Do we have castor oil? Or do we have mineral oil? Remember, I have not mentioned any of these drugs, but try to choose the best answer. How about let's have a try, Miss Ortega?
Letter A po.
Letter A. So let's see if the answer is correct. Actually, docusate sodium is correct. So this has not been mentioned in our discussion, but the first line of treatment for constipation during pregnancy is docusate sodium. Why not magnesium citrate? Because di ba remember, yung magnesium could be triggering in the when we mentioned about the antacid. Second, yung castor oil at mineral oil, ang problem diyan kasi pag binigay mo yung castor oil at mineral oil, mag-aano yan, magi-induce yan ng intestinal motility. If it will induce intestinal motility, it will trigger kasi the constipation itself, pwedeng mag-trigger po yan sa preterm or premature it will trigger uterine contraction kasi castor oil are usually 30 ml just like oil talaga just like yung cooking oil ang consistency niya at mineral oil, that's the one that you will take 30 ml tapos it will cause the increased motility of the GI tract and somehow since intestinal muscles ang focus, pwedeng maka-affect yan na mag-stimulate also of uterine contraction. So that could be at risk. So thank you so much. That's the answer. Next question. Next question is the nurse is teaching a pregnant patient how to decrease the gastrointestinal distress she experiences with prenatal vitamins. The nurse instructs the patient to do what? Take her vitamins between meals, eat when she takes her vitamins, drink orange juice when she takes her vitamins, and letter D, drink when she takes her vitamins. Anyone? Kasi the problem is gastrointestinal distress. Tapos upon experiencing the okay, Miss Micaela?
Letter B po.
Letter B. So tingnan natin if the answer is correct. Okay, best answer. That's correct. Why? Kasi remember class, 'di ba, most of the instances ng mga multivitamins at any oral drugs ay pwede mag-cause ng gastric irritation. So much better that will be in a full meal. Kasi take her vitamins between meals, ibig sabihin between meals the stomach will be empty. So pwedeng mag-trigger 'yon, 'di ba? Orange juice, o sabi natin, orange juice di man sinabi dito na flavored or concentrated. 'Di ba? Multivitamins must not be taken with the concentrated high acidic juices. And another again, if you can remember, don't give the drugs most such as the multivitamins with milk. It will counteract its effect. So next question. So we have only 2 minutes to go. The nurse at an infertility clinic working with a preconceptional couple, the nurse advised the woman to take which supplement for at least 3 months before becoming pregnant? Iron, ginger, folic acid, vitamin B6. So Miss Sipin, answer?
Letter C po.
Tingnan natin ha. Okay? Correct. Folic acid. Because again, ginger, root crop, hindi pwede. Hindi pwede. Kasama yan nila garlic, hindi pwede. Ang iron is given at the early third trimester, di ba? So ang folic acid talaga yung sa early months. Okay? And vitamin B6 or pyridoxine. So next question. So I think this could be the last kasi we are already having the quiz that will be posted. A primigravida patient, 8 gestational week, is at the prenatal clinic. She complains of nausea and vomiting every morning. Which comment made by the patient would indicate the need for further instruction? My friend gave me a ginger cookies to eat. P, I have been eating dry crackers before I get up C, I have tried to avoid foods with strong smell. D, I have been drinking chamomile tea every day. Alin dito yung very alarming? Yes, Miss Alisa.
Letter D po.
D, which is I have been drinking chamomile tea.
Yes, yes.
Yes. So tingnan natin if that is correct. Correct. Why? Kasi 'di ba as what I have told you, yung mga herbal preparations at mga teas that does not support yung situation during pregnancy could be risky. So you have the correct answer. So I think this will be the topic for the next meeting. And let us open now our cameras, please, because it's already 7 o'clock. Your quiz are already open. I will stop the sharing.